Hello, am I audible?
Hello.
Yes.
Yes, you are audible, sir. Sir, the program will start soon. Actually, we are waiting for Professor Surya Prakash joining.
The webinar will begin shortly. The webinar will begin shortly.
Mic check.
Okay. Hello. Hope I am audible to all. Good morning, Professor Surya Prakash. Sir, with
Good
your
morning.
due... Ji, sir.
You are audible. Okay.
Ji, sir. Sir, with your due permission, shall we start our program?
Please.
Ji. Namaskar. Welcome to the first webinar on overview of public health emergency, preparedness and response, jointly organized by the National Institute of Disaster Management, Ministry of Home Affairs, National Center for Disease Control, Ministry of Health and Family Welfare, and US Center for Disease Control and Prevention, Country Office, India. This webinar is the part of the monthly webinar series on Public Health Emergency and Disaster Management Connect, Bridging Knowledge and Action, scheduled Friday between 11:30 a.m. to 12:30 p.m. Disease outbreaks can escalate quickly, particularly where health systems are weak or facing emerging threats. Addressing such health emergencies requires a coordinated, multi-sectoral approach to strengthen preparedness and ensure health security. This webinar marks the beginning of the timely and important dialogue on strengthening our collective understanding and action around public health emergencies and disaster management. Now let us start our webinar with the opening remarks by Professor Surya Prakash, Head GMR, CBRN Industrial and Cyber DRR. The floor is yours, sir.
Thank you, Dr. Harjeet. Good morning and welcome to all the dignitaries of the program, distinguished experts, delegates, and participants. It's a matter of extreme pleasure for all of us to launch our new web series on public health emergency and disaster management. The theme of the series this time has been kept on the PHEDM Connect, bridging knowledge and actions. Until unless the knowledge is being shared through such platforms, not utilized into our practices or actions, it will not be able to bring any benefits to us. The need for the integration and mainstreaming of public health emergencies with disaster management was felt during the COVID period when the epidemic spread out across the globe. It was required to impose certain regulations and controls to contain this disease and also to overcome its consequences. A lot of support was required as the infrastructure, health infrastructure particularly, was very weak in terms of its resources as well as the funds available to meet the challenges of the such a huge epidemic's impact. Therefore, the different governments, they came together, worked as a team, and tried to meet the adversities of that particular epidemics period. And we came out with an approach that if we can integrate both the resources, knowledge, ideas, and experiences of public health emergency specialists along with the disaster management professionals, it may be very helpful as it has proven during the COVID-19. Therefore, this idea was very well accepted by all stakeholders. Later on, NIDM, which was has been a nodal institution as per Disaster Management Act 2000 for training and capacity building in the field of disaster risk reduction and resilience, joined hands with NCDC, which is an institution under Ministry of Health and Family Welfare, as well as the USCDC, Country Office India, to initiate some programs pertaining to public health emergency and disaster management. The series proved to be very useful to all such stakeholders who are expected to have their roles and responsibilities to be rendered during the COVID period. We received a lot of appreciations about the outcomes of that webinar series. And we were expected to have another series to continue the same efforts for future risk reduction and resilience. During G20, when the health related meetings were held, the idea was again floated, and it came out that not only health but disasters have to be also looked into from our survival as well as coexistence and sustainable development, looking into the emerging challenges of climate change and fast pace of development. So look, all this were discussed by all the three partners who have worked earlier and came out with the number of training modules and a development of 5-tier approach on public health emergency and disaster management, covering every sector and all levels field of public health emergency and disaster management. With that, I would like to state that such crisis may recur again, and in order to avoid, prevent and mitigate such risks to the mass populations at the national and the global levels, we are initiating this new series to talk about the changes in practice, behavior and attitude which are required as per the existing knowledge and also the innovations being done in this particular area. So I'm happy that we have tried to also take away some learnings from our past and also the new amendments which have taken place in the Disaster Management Act during the year 2025 in the last week of March 2025. We are now also establishing the urban disaster management authorities. So besides the center, state and district level authorities which are taking care of disaster management and public health emergencies, where there would be now local level authorities who will also undertake initiatives to strengthen our endeavors in public health emergency and disaster management. So this webinar series would be a step forward to build a robust and resilient health infrastructure and disaster resilient mechanism and processes that will help us attain the goal of national policy on disaster management, which is zero casualty, disaster free and resilient nation. I hope we would be able to engage, encourage and help people share their thoughts, insights and collaborate among themselves and drive towards impactful solutions for future risk reduction and resilience. On behalf of NIDM, I would like to express our heartfelt thanks to our partner organizations and particularly the officials who have been supporting us and cooperating with us quite a lot. I'm very much thankful to them. I would also like to express our heartfelt thanks to the heads of the institution. Currently, NIDM is being headed by Shri Rijviji, who is advisor at NDMA. And also thanks to Dr. Ranjan Das, who is currently the director of NCDC, and also Dr. Meghna Desai, who is director at USCDC, country office India. I'm also thankful to my colleagues who have also connected and cooperated and supported all our endeavors, particularly Dr. Himanshu Chauhan, Dr. Rajat Garg, and other colleagues like Dr. Sanket and many others who have supported us. And I also like to thank our team, which is helping us in execution and implementation of such programs. With these words, I thank one and all and hope this effort will enhance our preparedness and improve our resilience in the field of public health emergencies and disaster management. So wish you all a productive and an insightful series ahead. Thank you very much and wish you all safe, healthy, good quality life on an equitable, justifiable and right-based manner. And I think we will be able to march ourselves to our destination of the national goal. And we have begun the journey, and the milestones we will be covering with each of these webinars during the series towards our destination. So wish you all the best. किसी शायर ने कहा कि मंजिलें उन्हीं को मिलती हैं जो सफर अख्तियार करते हैं, ऐसे मुसाफिरों को तैयार हो रास्ते भी इंतजार करते हैं. So I think we have started this march forward and wish you all the best, and particularly during the current situation when there is a tense environment around us. So I think these kind of preparedness measures will surely help us a long way. So thank you very much and wish you all the best.
Thank you, sir, for clearly highlighting the objective of today's webinar and for setting the context of our discussion. Your introduction has laid a strong foundation for our session on the overview of public health emergency preparedness and response. Thank you, sir. Now, I would call Dr. Meghna Desai, Country Director, U.S. Center for Disease Control Prevention, Country Office, India, for her address. Over to you, ma'am.
Okay, thank you so much. Good morning, everyone. All of my distinguished dignitaries, colleagues, and partners. And thank you, Dr. Surya Prakash, for leading us off today. So I'm really honored to really join in this FEM Connect webinar series, aptly titled Bridging Knowledge and Action, jointly organized by NCDC, NIDM, and CDC, country office here in India. This timely initiative aims to strengthen the capacity of the stakeholders that are engaged in public health emergency and disaster management. And as you said, I think, you know, the timeliness of it is very crucial right now. So India continues to shine as a global health leader. It has made significant contributions to vaccine development and distribution of COVID-19 vaccine throughout that pandemic. And in collaboration with the United States, it really reflects our shared strength and commitment to public health emergency and disaster management. As we look to the future, India's emphasis on research, innovation, as well as people-centered health systems really places it in a strong position to address both national and global health challenges. So a cornerstone of this initiative is the effective collaboration amongst NIDM, NCDC, and CDC. And together, we are implementing this 5-tiered public health emergency disaster management framework, the FEM framework, which is really empowering stakeholders at every level, from communities to policymakers, by strengthening workforce, infrastructure, and institutional systems. So CDC is really proud to support the adaptation of global emergency management principles to the Indian context, and we've been doing this for quite some time now. Through these tiered training modules, the FEM program builds practical, real-world capacity across all levels, and we are ensuring that through that, none of the districts, are left behind. So the Tier 3 FEM program has been training district-level officials in 5 states to date, and they have been enhancing their ability to assess risk, plan, respond, and recover using IMS as well as IRS frameworks. These programs focus on strengthening the 3 S's that you all may be familiar with: the staff, systems, and staff within each of the local contexts. But learning must be ongoing. And so based on feedback from previous participants of some of these webinar series, this series was launched to foster continuous engagement, share some of the real world experiences that we have, and promote innovation in public health emergency and disaster management. One of the key objectives of this series is to showcase the best practices and lessons learned at the district and state levels. These case studies can reinforce India's leadership in public health preparedness and response. So I'm really confident that today's session and the entire webinar series will be enriching for all participants. And I know there's almost 300 of you online. And my sincere thanks again to the speakers for their time and expertise, and to NCDC and NIDM for this collaboration and really leading this important capacity building initiative in India. So thank you again.
Hello. Thank you, ma'am. Thank you for your kind words and valuable inputs during the inaugural session. Sir, can you confirm that NCDC director is joining with us, or he may be joined later?
So, good morning, everyone. And on behalf of Director NCDC, I convey his apologies for not being able to connect today, as there are other crisis looming and other high-level meetings concurrently happening. So he's in one of those meetings chaired by Secretary Health right now. So on behalf of Director NCDC, I acknowledge this unique initiative that has been undertaken by National Institute of Disaster Management, representing Ministry of Home Affairs, the National Center for Disease Control, representing Ministry of Health and Family Welfare, and the US CDC India, coming together and connecting all stakeholders who are engaged in public health emergency and disaster management, and targeting all the levels from community level to the leadership, the topmost leadership levels. So this is something which is very unique. Looking at the public health emergencies and disasters as two faces of the same coin, and not separating them, and realizing that they rely on common management principles, and even at times tools to deal with them are common. Therefore, the need to connect them as one, and train a group of people. Anyone trained in public health emergency and disaster management, this program, this unique program, is capable of working at any instance, any role in a public health or a health emergency or an EOC setup. So they are fully conversant. The aim of the training is to make them fully conversant with the roles and responsibilities that they may be expected to play in an emergency setting, in an emergency operation center setup, and also be fully well versed with the principles of managing any emergency or disaster under that common system. So with those words and thanking all the 260 plus, nearly 300 participants, primarily the NIDM team led by Professor Surya Prakash, the CDC India team led by Dr. Meghna Desai, and my own team here. So I'd like to thank the organizers, and we can start with the technical session.
Thank you very much, sir. Yes, sir.
Before you start the technical session, just I'd like to share with our partners that we got around 357 registrations, out of which around 150 they were from our trainings of PHEDM tier 3, and around 200 from others. So that is quite good, and around 26 states they are they have registered for this particular webinar. So I think it's a great input that we have received. At present, we have already around more than 270 participants already participating in this. Thank you.
Thank you very much, sir. As you're highlighting the significance of PHEDM Tier 3 training, and your remarks underscore how this initiative brings together a diverse range of stakeholders, creating a unified platform that spans from community level participation to senior officials. And this inclusive approach is vital to ensuring that preparedness and response efforts are comprehensive, well coordinated, and grounded in the realities faced at all levels of the system. It reinforced the importance of whole of society approach in building resilient public health emergency systems. Thank you very much, sir, for your address. And now we move to our technical session. So our first speaker is Dr. Himanshu Chauhan, Joint Director, Head IDSP at NCDC MoHFW, Government of India. He will be speaking on basic of public health emergency and disaster management. The floor is yours, sir.
Thank you, Dr. Harjeet. So the session now we are recapping essentially the modules that the trainees have already undergone during their sessions. And we also have participants who represent sectors and areas that they haven't already covered, they haven't been trained. So it's a mixed group here. The aim is primarily to create a community of online learning wherein we can recap some key lessons that we learned during those trainings, and also to sensitize the new participants about this approach, the public health emergency and disaster management. Next, please. So this particular session, we targeted understanding the critical linkages between public health emergencies, disaster risk management, and climate change is like the overarching umbrella, because everything is happening under this rapidly developing area where we are trying to understand the full impact of climate change on everything that we do in our day-to-day lives. And also identify and apply disaster risk reduction strategies, public health interventions, and climate change adaptation measures, especially during health crisis. Next. So the key question then arises at the very beginning is what is the difference between an emergency and a public health emergency? While there is certainly some overlap which is expected, but while we look at public health emergency, we specifically talk about any event or situation that poses a significant risk to public health and requires immediate action. That is also similar to what an emergency situation is, wherein health is not specifically targeted. But when we talk about public health emergencies, we may be looking at infectious disease outbreaks, natural disasters leading to health crisis, and chemical or radiological accidents. And as we speak, we can also correlate with situations that may not be directly related, but may lead to public health emergencies. Like, for example, Professor Surya mentioned the ongoing Operation Sindoor and its potential ramifications may have public health emergency implications. Next, please. So then disaster, how does it stand apart, or how does it appear to be different from disaster? Disaster is as defined under the DM Act, the Disaster Management Act of 2005. Anything which is significant enough and beyond the coping capacity of the community of that affected area can be a disaster. Disaster has to be declared by the competent authorities, whereas public health emergencies are usually considered that any of these events may constitute a public health emergency. Again, the common elements would be substantial loss of life, destruction of property, or damage or degradation of environment. Next, please. So one of the key components having in the common elements of what is the cycle. It's a cyclical approach where the efforts, they continue. So there are some steps which are expected to be taken during the peacetime. So effects like preparedness, effects like mitigation and prevention, these precede the occurrence of any disaster, and therefore applying these principles on the public health emergency management framework, we also see a kind of a similar situation emerging and a similar scope of intervention developing there too. So we'll have to prepare for any public health emergency, like the prevention measures, the mitigation measures, but the impact ultimately whenever it happens is minimal. And expecting that the public health emergency is going to happen, we initiate upon the preparedness measures. So that's where the surveillance system of various sectors, human health side, animal health side, they play a crucial role that they signal the impending outbreak or impending public health emergency or crisis developing. And once that happens, the team has to be ready through response and relief measures. And that's where the role of emergency operations centers becomes so critical, that emergencies keep on happening despite the best mitigation preventive measures, despite the best preparedness measures. There are emergencies that would happen. So then they have to be responded in a very systematic manner. So the response and the relief ultimately ending with rehabilitation and reconstruction. So that particular emergency or disaster, once it happens, it ends with rehabilitation and reconstruction, and the lessons learned are then incorporated into the mitigation, and the cycle then continues. Next, please. So disaster risk reduction is systematic efforts and measures taken to minimize the vulnerabilities and exposure of communities to hazards, as well as reduction of disaster risk. So we see hazard, exposure, and vulnerability all closely linked, and the common area where they overlap is what defines the risk. What is the risk to the community or to the society is where these elements overlap. Next. Hence, this unique initiative of connecting these two, the disaster management principles, which are very well defined. They have a legal backup, a mandate, structures to implement the mandate in the act. And on the other side, public health emergency management, which has only been highlighted on the global stage through this COVID-19 pandemic that we all faced. And we realized how closely these two are related. But also the realization that dawned upon all the policymakers was that essentially there's no connect between the two. So this initiative connects public health emergency management and disaster management as one. Next, please. And the One Health approach, just like I mentioned climate change a little while ago, but then everybody, including the component of climate change, has to be looked at from the One Health perspective, that nothing happens in isolation. There's an environment, there's stakeholders across the human health, animal health, wildlife, and climate change, and other sectors also. So this whole of society and whole of government approach is essentially what translates into our One Health initiative. So this PHEDM program also focuses, it doesn't lose sight of that One Health approach, that we're not just looking at the human health part of it, but connecting sectors as well. Next. So the objective of this PHEDM is to create a cadre of public health emergency and disaster management professionals in India. I'll talk about we have already achieved significant progress in this regard, to develop a core group of public health emergency and disaster management trainers as well, and training all the sectors across all levels, as I said, from community to policy level, thereby increasing public awareness and ensuring community participation in public health emergency and disaster management initiatives. Next, please. So this is essentially the 5-tiered approach where the community capacity building is targeted for the community level workers. The tactical level is between the district and community, where actual action is supposed to be led by these key identified responders and workers who are present at that level. The operational level is more about guiding a particular response at the district level, and responsible for preparedness plans as well. The strategic and the governance and leadership level top it up at the apex. Next. And I mentioned about the One Health approach, that it does not happen, no emergency or disaster happens in isolation in one sector. All the sectors involved need to be connected, and all the sectors are involved and affected whenever such a crisis happens. Next. So looking at the progress so far, we'd like to thank all the states and the participants who are today connected from these states, the leadership of these states, so that we have successfully completed the Tier 1 training in Rajasthan, Tier 2 in Rajasthan as well, and tier 3 across the states which are highlighted here. And 619 officials, participants, responders who are engaged in giving direction to any crisis management at the district level. They have been trained through this initiative so far, and we are expanding next week. Bihar is being targeted. Bihar leadership has also agreed, and we'll expand it in a phased manner, targeting 15 states in the beginning, and then maybe expanding it to other states and UTs as well. Next, please. Next. So these are some glimpses of this training, the tier 3 level trainings that we have conducted. So starting the day with positive thoughts and positive energies flowing across the participants in the form of yoga sessions, meditation, and leading up to mock drills by NDRF. NDRF has always been a key stakeholder and a participant in these trainings. Communicating and giving us the assurance at the district level that these teams are present as the face of disaster response whenever the crisis occurs. And the technical sessions, which are more of activity based than lecture based. So the lecture based sessions, they set out the framework, and the activity based sessions then cement further those principles which are enshrined in those lectures. Next, please. So the training package which was developed is successfully implemented in these states. These are again some glimpses from the various trainings that we have conducted so far. The leadership has been supportive. We can see DGHS, who was also then director NCDC in a few sessions. We also see leadership from disaster management side. CDC leadership has been one pillar of strength in these trainings. Next, please. So it's not just a training module which has been developed once and it is implemented in all the training similarly. Every time a training is conducted, it is focused on local needs. The training curriculum is reviewed, fine-tuned, and made specific to what are the needs of the community, the local context, that is to say. And it is a constant process where revision and upgradation happens. The last session that we did was just about a couple of weeks ago, where a comprehensive review of those modules was undertaken, and those revised modules would then now be used in the upcoming training. And this is what happens after every training, hot wash sessions to capture what went well, what did not go so well, and what can be improved. Next, please. The case studies form an essential component of these training sessions, and these case studies, the districts where these, the state and the districts where these trainings are conducted, they can relate to them readily because it is actually based on the emergencies and disasters that they have responded to in the past. So these are then carefully selected based on the inputs provided by the district and the state, and they are further developed by a team of experts so that in future sessions also they can be used. Not only that, presentation of these case studies and the actual response by the trained cadre, they also provide an opportunity to present these findings at various platforms at state, national, or even international levels. Next, please. So having said that, it does not end with one-time training, one-time visit to the state and the district, there's a system which requires a follow-up. There's a system which requires that all the trainees, all the participants are connected on some platform. So we have created WhatsApp group state-wise of those stakeholders, trainees who've undergone these trainings. And the key roles and responsibilities that are expected after the training, they are kept alive. The discussions, the developments, and the latest updates are shared across on those platforms. However, specifically to recap and reiterate, I would like to mention that this webinar series, like what we have initiated, it is an effort to ensure that participation of the capacitated officials, it is ensured. We also want that mentors and mentees to collaborate and meet regularly, maybe monthly, quarterly, whatever is feasible at that district level. And a key deliverable is a public health preparedness plan for that district. And this is based on the district disaster management plan, which is legally mandated and available in all the districts. To use that plan as a template and develop a public health emergency preparedness plan so that the disaster management principles strengthen the public health emergency preparedness principles. We also expect that as we go forward, where tier 3 trainings are conducted, we expand into tier 1 and tier 2 sector as well, and undertake systematic documentation of case studies. The Silkara Tunnel experience, Uttarakhand, where PHEDM structure and the lead there were a key component, key part of that response that's been very beautifully documented. So all the disasters, all the emergencies that are responded to, they are carefully documented by this mentor-mentee system that's been created. Next, please. So these are the links to certain documents that would be useful for the participants to recap. If they have lost the physical documents that we have shared with them, they are always available online. Next. And that's this session about. So if there is any scope for any queries and comments, maybe later on we can discuss. But thank you very much for giving me this opportunity.
Thank you, sir, for a detailed and informative presentation. You provided a comprehensive overview of PHEDM training program, and your talk effectively outlined the foundational concept of public health emergencies and disaster management, emphasizing the importance of integrating disaster risk reduction strategies and the One Health approach. And I would also thank our participants for joining with us, and we have one more presentation coming up, after which we will have a dedicated question and answer session. We will take all your questions together at the time, and in the meantime, I kindly request everyone to type your question in the chat box so we can address them efficiently during the discussion or at later stage. So next we have with us Professor Surya Prakash, Head GMRD, CBRN and Industrial DRR Division, NIDM. I would request Professor Surya Prakash to share his expertise on international and national framework for PHEDM. The floor is yours, sir.
Thank you, Dr. Harjeet. I think my work has been made easier by the presentation through Dr. Himanshu, who has actually very briefly highlighted how we have been working on our development of modules and its revisions as well as its delivery, and also focusing on the practical parts of it, and most of the programs having around more than 70% the activity-based learnings besides the theoretical and knowledge-based inputs. So this is one of the, I think, best programs I could ever find throughout almost 20 years of my career as a trainer. I've been working on training of trainers, direct trainings, and master trainers. But there was least emphasis on development of mentors and mentees concept. And these programs actually address that need too, that we have to actually bring out the leadership and motivation among the mentors, and also have our mentees to go further ahead as mentors in their own programs to take up the leadership ahead as a chain reaction through the catalytic process. And also in these modules, we have not only had the direct training modules or trainees modules, but we had also the facilitators module as well as the mentors guide. So these three different type of modules which were developed for 5 different levels.
Hello. Sorry, sir. Hello.
15.
Yes, sir. Sir, your presentation is.
No, I'm just giving a background
Okay.
of just I'll start
Sorry, sir.
my topic. But before that, I wanted to pass on my appreciations to the previous speaker's presentation, which has highlighted some of the very good things. And just the difference which has come up with that we have now 50 for all the 5 total PHEDM approach, which will be developed to the collaborative process and consultative process. When I come down to the topic that has been requested is the international and national frameworks for PHEDM. Let me share a presentation and then I'll go ahead with that. Just let me know if the PPT is visible.
Ji, sir.
Okay.
Yes, sir. Sir, make it full screen, sir.
I have made it full screen.
Yes, sir.
Is it visible or
Now
not?
it's, yes, yes, sir. It's visible, sir.
Full screen, hai na?
Ji, sir. Ji, sir.
Okay. So now what I'll do is I'll focus on the theme on which I have been assigned the topic. So what is expected from this particular deliberation is that the participants of this program will be able to familiarize themselves with the key international and national frameworks that form the foundation of public health emergency and disaster management. Particularly, it is part of Tier 3, that is for the professional development programs and capacity development initiatives. So if I look at the international frameworks which relate to PHEDM, include the international health regulations, which have been developed by World Health Organization. These international health regulations are actually legally binding on international agreement aims to prevent, detect, and respond to international spread of diseases while minimizing interference and international travel and trade. So therefore, the points of entry, which can actually spread diseases across the countries, have to be actually properly monitored, and the detection of the diseases to be done to prevent spread and also respond to the epidemiological disasters that can happen across the countries. Then the second important agreement and agenda which was taken up way back in 2014 by the global partnerships which was launched in across the countries on global health security agenda. It was actually to build capacities of the countries and strengthen them to prevent, detect, and respond to infectious diseases threats. Now, this initiative actually began to follow as a follow-up action of international health regulations because they need to be implemented, and therefore the GHS agenda actually strengthened that process. Then during 2015, we had UN development groups meetings, which took up the sustainable development goals, the 17 sustainable development goals, which aimed to end poverty, protect planet, people, and also improve their prosperity and their lives of everyone, everywhere across the globe. There were some agendas which were very much closely related to health emergencies and health aspects. For example, SDG 3, which talked about good health and well-being, was one of the important agendas under Sustainable Development Goals. Then there are impacts of changing climatic conditions due to heat waves and drought conditions, malnutrition, and other such factors. So the climate action, SDG agenda goal 13 on climate action was again an important agenda under SDGs. And the 17th agenda, which talks about the partnerships for the goals, is actually inviting collaboration and strengthening all stakeholders. So these are some of the important points need to be considered from that particular international health framework on PHEDM, particularly pertaining to sustainable development goals. Then I also remember in March 14th to 18th, we had the Third World Conference, and there we came out with a Sendai Declaration, Sendai Framework for Disaster Risk Reduction, which was suggested by UNDRR, that is United Nations Disaster Risk Reduction Office. It came out with 4 priority actions and 7 targets, which set out priorities to reduce disaster risks, and also the priority actions envisaged strengthening of governance for DRR as well as investments in DRR, and also taking up all necessary actions for risk assessments and learning from the past events and build back better. So these approaches which were there during the Sendai framework, they are also relevant to contain, control, and manage the public health emergencies too. Paris climate, this was also again an important discussion which took place during 2015 and during the Conference of Parties meeting at Paris. There it was decided that we should try to limit our warming level on an average global warming to less than 2 degrees and above the pre-industrial levels, and also pursue efforts towards the more ambitious target of 1.5 degrees Celsius. So all these 5 international frameworks, they pertain to the environmental conservation, protection, public health emergencies, and disaster management, as well as sustainable development. So we have to integrate, converge, and mainstream all these efforts together and pool or synergize our energies to attain our goals of disaster-free and resilient nations. Now, at the national level also, there have been a number of attempts, particularly our constitution of the country in its article number 47 states that the duty of the state to raise the level of nutrition and standard of living to improve the public health. So rather than responding to the situation when the public health emergencies arise and get worsened, it states that the states should look into the levels of nutrition, that nobody should have malnutrition, and also standard of living to improve the public health. And also the constitution in its 7th schedule has listed different functions pertaining to public health emergencies in union, state, and concurrent list. The Indian Penal Code and Bharatiya Nyaya Sanhita, they have also put up some sections to deal with the response situations during the public health emergencies and disaster or crisis situations. It emphasizes through chapter 14 under sections 269 to 278 of the Indian Penal Code 1860 as well as the Bharatiya Nyaya Sanhita 2023 to deal with offenses affecting public health. These sections actually aim to regulate and penalize various offenses that pose threat to the public health. So these are some of these important legal interventions that have been initiated in the country and were there in the constitution. Further, in 2005, December 23rd, the Disaster Management Act 53 was notified, and it brought out institutions, major organizations, that is National Disaster Management Authority, National Institute of Disaster Management, and National Disaster Response Force at the central level, which also work dedicatedly for the different purposes in the field of disaster management. This is also related to the national level disaster management plans through section 10, subsection 2. The Secretary, Health and Family Welfare can enhance or to enhance preparedness and response to any biological disaster. Each ministry, department, and organization, as per the legal provisions under this act, has to prepare a DM plan, and the nodal agencies which have been defined through the National Disaster Management Plan 2019 have to actually take up their basic activities, and MoHFW being the nodal ministry for biological disasters have to prepare an NCDCs one organization is being dedicatedly expected to work for public health emergencies and disaster management. We already had during the British periods the Epidemics Disease Act of 1897. Now, during the COVID-19, when the violence took place, an ordinance was brought in by our Government of India in 2020, which included the protection of healthcare workers and regulatory powers during the epidemics. So this is again one of the provisions which were undertaken, and the Bharatiya Nyaya Sahita 2023 had several sections which deal with public health emergencies and disaster situations. The section 271, it penalizes negligent acts likely to spread infection. Section 272 targets malicious acts knowingly spreading the disease. Section 273 penalizes willful disobedience of quarantine rules. And Section 163 empowers state and local authorities to issue directions to prevent threats to public safety, health, or order. So these are some of the important legal and national frameworks which are very helpful in further actions. I'd like to elaborate a little bit on the Disaster Management Act, which is an overriding act over many other acts. So therefore, the disaster management plans, which have also been revised as per that amendment which took place on the last week of March 2025, and we have now Disaster Management Amendment Act in the year 2025 notified. The national authority shall coordinate as per section 11 in consultation with the central government and the state governments as well as other stakeholders in the field of disaster management for preparation and approval of national plan, having agreed to national policy. National policy on disaster management, it was released on 22nd October 2009 and had 10 chapters which enlist some of the major activities and also envisages a level of cultural change to bring proactive and continuous actions in the field of disaster management. The national authority shall review the national plan once in every 3 years and update at least once in every 5 years. So now we are expecting that the National Disaster Management Plan may also be revised and updated. The expanded roles will also include the climate risk assessment because climate related events are also emerging and disaster event as extreme weather events, and they can also include the events like heat waves, lightning, and cold waves, or the drought like chronic drought situations which can also emerge due to changing climatic conditions, or flash floods, fires which can happen in the forest area. Technical assistance, setting relief standards, and maintaining disaster databases. Now we have disaster management information system at the national level, which is working on collection of disaster database, and disaster database will have a crucial information related to disaster assessments, fund allocation, expenditure, preparedness, mitigation plan, and risk registers. This data will improve our data-driven decision-making policies and enhance transparency. Strengthening of disaster risk governance will not only depend on this disaster database, but also bring down it to the grassroots levels, particularly to the level of the local authorities. As per Chapter 6 of the Disaster Management Act, there is a change which has been brought through Section 41A to establish urban disaster management authorities. You know that municipalities, they too also have responsibilities to respond to public health emergencies too. So therefore, the states through the municipal corporations and bodies can also establish urban disaster management authorities, except Delhi and Chandigarh. The state disaster response force, because National Disaster Response Force may have limited presence across the country, the state can constitute SDRFs and also establish even state institutes of disaster management as per the 15th Finance Commission recommendations. Statutory status to key committees like the National Crisis Management Committee, it was earlier not included in the Disaster Management Act, and also the high-level committees, but they have also been included in the amendment under the Disaster Management Act 2005. Now NCMC, which is National Crisis Management Committee, headed by Cabinet Secretary, is also included in the Disaster Management Act, and the high-level committee, which is again headed by Home Minister, Union Home Minister of the country, having administrative control over disaster management. So these are the key changes which have taken place recently. However, there have been some acts, policies and rules, guidelines and regulations across the country for different other areas. For example, for chemical related acts and policies, there are a number of acts which I have just stated here. Factories Act 1948, Insecticide Act 1968, Environment Protection Act, which came up after the Bhopal gas tragedies in 1986, and then hazardous waste, that is management, handling and transport movement rules 2008, manufacture, storage and import of hazardous chemicals rules 1989, Chemical Weapons Convention Act 2000, Public Liability Insurance Act. This is very important, particularly for the workers in the industry. Came out in 1991, and National Policy on Safety, Health and Environment at Workplace in the year 2009. There are other acts which are related to biological related situations. Epidemic Disease Act 1897, I have already mentioned. National Health Policy, it came up in 2017. The Biological Diversity Act in 2002. Drugs and Cosmetics Act 1940. Livestock Importation Act 1898. Food Safety and Standards Act 2006. The National Disaster Management Guidelines on Biological Disasters came out in the year 2008, and the Epidemics Disease Amendment Ordinance came out in 2020. There are other type of disasters which also relate to biological disasters. These are radiological and nuclear disasters, and this also has some of the acts and provisions or policies. It includes Atomic Energy Act 1962, Radiation Protection Rules 1971, Atomic Energy Safe Disposal of Radioactive Waste Rules 1987. Remember, there was a case of Mayapuri where a radioactive leakage caused some problems in Delhi, and this was reported and then taken care of. Then DM Act also takes care of it. Environment Protection Act 1986 also talks about it. And the Weapons of Mass Destruction and their Delivery Systems talks about prohibition of unlawful activities during the act which was brought in the year 2005. The national guidelines brought out by NDMA on management of nuclear and radiological emergencies 2009. Then we have a national policy and guidelines covering CBRN as a whole, that is chemical, biological, radiological and nuclear disasters. And these have been considered under the National Policy on Disaster Management and also CBRN emergencies during 2008. Now we have to act proactively, so early warning systems are prerequisites, and early warning for public health through IDSP, Public Health Emergency Surveillances, and also through our CAP, Common Alert Protocols, are shared through the Sachet app. Then the action hazard specific early warning, particularly through our nodal agencies on specific hazards like cyclones, floods, tsunami, etc., must be linked directly to public health emergencies. I remember during this 1993 Latur earthquake, there was a plague spread out, and 2001 Kutch earthquake also, we had the spread of malaria, and also we had some problems of dengue and others during the 2004 tsunami and many such other disasters. So outbreak of public health emergencies during the disaster situations, and also public health emergencies in terms of biological disasters turning into disaster situations have to be dealt appropriately, enabling timely evacuation, medical preparedness, and outbreak prevention. Establishment of urban disaster management authorities is likely to help us a lot in these directions, because they will be able to take care of the spread and the occurrences of such or outbreaks of such diseases at the local levels. Promote convergence at all levels and across sectors under the Disaster Management Act. There is an ecosystem-based approach, One Health approach, and climate adaptation plans which need to be unified to make a robust and resilient public health, emergency, and disaster management ecosystem capable of addressing multi-hazards in the coming future. Some of the documents which our participants can look into are available at NIDM website. They are available free of cost, and anybody can download and look into these documents which are made available, and the revision is in process. So these are some of the websites where laws enacted by the states are also available. Many of these states, they have already taken initiatives, and as said by our colleague Dr. Himanshu, we have already taken these public health emergency and disaster management in 5 states. That is Gujarat, Rajasthan, Uttarakhand, Maharashtra, and Jharkhand. And now we are implementing it in Bihar, which would be the 6th state to cover up all this. And around 700 participants have already been trained. And these websites will also provide more information to state-specific endeavors and initiatives as well as interventions. So with that, I'll close this presentation. If there are any questions, I would be happy to answer. So thank you very much for this opportunity. Back to you, Dr. Harji.
Thank you, sir, for an excellent and informative presentations. Your session provided through overview of both international and national framework that support PHEDM, and you clearly outlined the key instruments such as IHR and emphasized the constitutional and legal responsibilities of the Indian state in promoting public health. Importantly, your discussion on the way forward emphasized the need for hazard-specific early warnings, convergence of multi-sectoral policies, and integration of the One Health and climate adaptation approaches. Thank you once again. And now we have question and answer session. And sir, we have received a number of questions in the chat box, and we truly appreciate the active participation. Due to the time constant, we will able to take only 3 to 4 questions. So the first question is for Dr. Himanshu, sir. This question is raised by Mr. Arnab. Sir, he is saying that you spoke about the integration of various sectors, particularly public health, disaster management, and animal husbandry. From your perspective, how can this integration be effectively implemented at the state level? And what specific steps or mechanism do you believe are necessary to achieve this coordination on the ground? Over to you, sir.
Thank you so much. So basically, Dr. Himanshu Chauhan has to leave for attending some directors meeting. So I would be responding on his behalf. Myself, Dr. Saurabh Goyal, I am also working as Joint Director in the IDSP unit, and I have also been the part of these PHEDM trainings that have been done in all these 5 states. So I have received the question of Mr. Arnab, in which he is asking about the various processes and the mechanisms which are in place or which are to be done for bringing out the collaboration between the various sectors at the field level. So I would like to tell you that there are several already existing the mechanisms under which we are ensuring and trying to bring about these collaborations between the various sectors like the animal husbandry, public health, disaster management, etc. So just to give you the glimpse of the things that are happening is the first one is the PHEDM trainings which are conducted in these various these states. So it has already been described. There are the five. This is a 5-tiered system, and whenever these trainings are conducted in the states at the various levels, we make sure that we have the participations from all these sectors in which the nominations are invited from the public health department. Mainly it is the public health department. Then we have the nominations from the disaster management side, from the animal husbandry side, and the wildlife also. Then we have the plans have to disaster management plans. They have to be formulated at the community level and at the block level, in which the participation and the feedbacks are required from all these sectors. And then there is the implementation of these plans. Then there are the checks and balances. The mechanism is the sector connect activities, which and the NCDC is the pivotal in doing the sector connect meetings. So the agenda of the sector connect meetings is that we go to the states and we conduct a 2-day trainings. In again, the participation from all the sectors is invited so that the people, they start knowing each other, they start sharing the TORs with each others, and they form and they take these trainings the forward. And in case of any kind of disaster or public health emergency, they carry about the joint response in the collaboration with each other. Then third thing is that we are having now the National Joint Outbreak Response Teams, that is short named as NJOD. So in these, this is basically the central level, the rapid response team, in which and this mechanism is like approved by the competent authorities. It is approved at the higher level. So the mandate of this team is to carry out the investigations, especially in the zoonotic disease and public health emergencies. Recently, yesterday, there was a human avian influenza case that is reported from the UDP. So it is very likely that a central level NJOD team will be visiting for investigating this outbreak. And in the past also, the similar zoonotic disease outbreaks, they have been investigated by the NJOD teams, in which the experts are there from all these sectors. And then we have the state surveillance committees and district surveillance committees. Also, again, the mandate of these committees is to carry out the monthly the meetings, and along with the data sharing exercises between all the sectors like the disaster management, the then animal health and the wildlife side. So I think this should answer your question. Thank you.
Ji, sir. Thank you very much for a detailed response, and I hope that address the concern raised by the participant and provides the clarity on this issue. So thank you very much, sir. And now the next question is for Professor Surya Prakash. Sir, the question is raised by Sumanta Rath regarding the early warning system and dissemination. What steps have been taken to ensure timely access to critical information, particularly in the context of disaster management, and how this information gathered and what mechanisms are in place to ensure it reaches the relevant stakeholder effectively, sir? Over to you.
Thank you, Dr. Harjeet, and thanks to the participant for active participation. It actually confirms us that somebody is listening to us. Otherwise, online, we are not able to confirm whether it's active participation or a silent attendance. Anyway, but this is very important question. This has been well addressed because the early warning, as I said, normally in English they say a stitch saves 9. So it's very important that we should know the cause, source, and factors or dimensions of any likely disasters. So what is happening that we have dedicated technical agencies. For example, so the weather monitoring systems or climate change impacts, we have Indian Meteorological Department. So for the weather predictions, they will continuously keep on monitoring the weather conditions, the changing parameters and variabilities, and whenever there are extremities or likely disasters, they will inform the National Disaster Management Authority and also issue information to the masses, because they are the nodal agency as per National Disaster Management Plan for the weather related disaster events like the lightning or heat waves and other disasters. On the other hand, we have other agencies. For example, for floods, we have Central Water Commission. And I said for the biological disasters, the Ministry of Health and Family Welfare. So these agencies are technically very strong in terms of detection, diagnosis, and also disseminating adequate information in a given format. But this is one part. How would the information would reach the public and what they are expected to do? That is another part. So the early warning systems are not just the collection and sharing of information, but also outreach and deciding the actions to be taken on that matter. So what has been done is that we have developed an app with the support from Department of Telecom through NDMA, and this app is called Sachet app. Sachet app is available on the NDMA website. You can download it in your mobiles, and it is geographically fenced, and it has an ability to push messages to all concerned stakeholders so that everybody becomes aware, informed, and prepared for the likely and forthcoming disaster-like situations. So this is all the information will reach to them. Now, what kind of information? If I just tell that the flood is likely to happen, or there may be some kind of lightning or other things. But along with that, they are also prescribing the action to be taken by the concerned masses. So this is how these actions are being taken up. That through the knowledge, we are able to bring out the information regarding the potential disaster situations, and then share through the communication systems, we are sharing that information with the masses and with do's and don'ts required for protecting lives and saving them. And on the other hand, if it is likely to be unavoidable and non-preventable disasters, then our response forces also come into actions for evacuation before the disaster strike, so that the maximum number of lives can be saved. And in case it is unable to come out or somebody gets trapped, then we conduct search and rescue operations immediately and put everything in predisposition and pre-positioned. So that is how we work on it. I hope I have been able to answer the question raised by the participant. If he's still not satisfied, and any subsequent question, I would be happy to answer.
Ji, sir. Thank you very much, sir, for your insightful response. And I trust this addressed the participant concern and offer great clarity on the topic. And we move to a next question. And I hope it will be answered by any of our distinguished speaker. This is in the context of public health emergency and disaster management. Is there any automated system or a process in place to support preparedness, response, and recovery before, during, and after cyclonic disaster?
Let me answer this question.
Sure, sir.
Because we have been, no, cyclones are natural hazards. they're inevitable whenever any low pressure areas come up, and they actually start then creating cyclonic conditions which can actually affect the coastal belts, particularly in the areas of Bay of Bengal and the Arabian Sea. Our coastal states are very much prone to it, and there have been so many instances when we have been exposed to it. Now, regarding the automation in this process, with the emerging technology like AI, the modeling techniques have improved quite a lot. Our efficiencies and accuracies have also increased. And AI also helps us in bringing automation in our actions too. But this automation is possible in systems which have some mechanically or computer driven systems, where that kind of sensors are available which can operate on automation basis using some software programs or apps. But for the humans or the other physical systems, they have to be activated and made to take those actions which can save human lives or livestock. So most often humans are not automated, but machines are, or processes may be. So products still can be exposed if they are not having adequate sensor systems for automation controls. So automated systems for, as was said, risk assessments are done using those systems, no doubt, in modeling, but preparedness and response, they may not be to that extent. Although in research and rescue, we are trying to use some automation systems detection of the human lives in terms of robotics, drones, and other technologies, but they are not completely automated.
Thank you very much, sir.
Anybody like to add on anything? You can add.
Anybody from NCDC side?
Just one point, sir. That is, as you mentioned rightly, that systems can be automated. It is not the staff. The processes, including the staff, can be automated to some extent. Like what we are preparing for EOC updation or EOC practices, the plan itself, how to go ahead in a automated manner, that is very essential until and unless it is being used and being prepared at the district level with respect to each of those hazards. That can be initiated at the district level, as you rightly mentioned, sir. So right now, for disease as a biological threats, for those, yes, only we have the detection, and AI tool is being used for the event alert generation. Only that can be that is used. This is my point, sir. Thank you.
Thank you very much, sir. And I believe this clarifies the participant concern raised by the, and sir, due to time constraint, we will now conclude the Q&A session. And I hope participants enjoyed wonderful presentation delivered by the speakers. And now I would request Dr. Saurabh Goyal, JD IDSP NCDC, for his concluding remarks. Over to you, sir.
Thank you so much, Alinji. So it was really nice to see that more than 200 the attendees, they have joined this session and they have listened to all these the deliberations by the experts. So I would like to tell you that this initiative of PHEDM, it started in 2022. Although it started small, but over the years it has progressed in leaps and bounces, and right now we have almost covered the 5 states, and the multi-tier trainings have been completed in these states. So just to share with you, more than 600 participants, they have been trained in at the tier 3 level, and more than 700 participants, they have completed the tier 1 and tier 2 trainings. So Moving ahead, I would request all the trainees who have completed their tier 1 and tier 2 trainings, like when they go back to their respective working areas, they should implement these trainings. They should be developing the case studies. They should be developing their plans. They should be operationalizing these plans in their respective field area, so that we can have the good examples and we can see the outcomes of these trainings whenever there is a disaster, so that we can be better prepared to deal with such emergencies. Moving ahead, we will be having around 7 to 8 webinar series, in which the first 6 series will be based on covering the different modules under the PHEDM. So by that time, I would request the trainees like to prepare good case studies and the scenarios and the best practices, because the last 1 or 2 sessions of this webinar series will be dedicated to projecting those best practices and the case studies, and whatever is the best amongst them, they can also get a chance to be the presenters in subsequent the webinar series. So with these words, I would like to conclude this webinar series for today, and I thank everyone for their active participation. Thank the NIDM, the other NCDC participants and CDC fellows for conducting this webinar series. Thank you so much.
Thank you very much, sir, for your concluding remarks. And now it's time to share a vote of thanks. So on behalf of NIDM, NCDC and CDC India, first of all, my sincere gratitude goes to ED NIDM, Shri Safi Ehsan Rizvi, IPS, Dr. Ranjan Das, Director NCDC, Dr. Meghna Desai, Country Director CDC India, for their blessing support to conduct this webinar. My sincere gratitude goes to Professor Surya Prakash, Head GMR Division NIDM, Dr. Himanshu Chauhan, Head IDSP NCDC, and Dr. Runa Hathi Gokhale, Associate Director CDC India, who are the co-chair of this webinar. Sincere thanks to our distinguished speaker, Professor Surya Prakash and Dr. Himanshu Chauhan, for their thoughtful, enlightened presentation and shown us a path towards public health emergency and disaster management. Let me thank to all the team members of NIDM, NCDC, and CDC India who have worked tirelessly behind this scene and for making this webinar a success. We also invite our participant to join us the second webinar in this series, which is on principle of PHEDM and its application, scheduled for Friday, 13th June, 2025 at the same time. With that, we conclude today's session. Thank you and have a wonderful day. Thank you.
Thanks to all the participants. Without them, this program would not have been successful. So thanks to each and everyone.
And I would request all the participants to fill the feedback form. The feedback link is shared in the chat box. So I would request kindly share your feedback with us.
Dr. Ajit, ask everybody to switch on the video so that you can have a photograph of all who participated in the first
webinar
of this series, the current series.
I would request all the panelists to switch on their video so that we can take a picture. Yes, I'm taking the screenshot of it. Thank you all.
Thank you.
Thank you, Arjit.
Thank you all.
Thank you, sir.
Thank you, Dr. Sanket and all. Dr. Saurabh and others.
Thank you, sir. So now we are ending this session. Thank you all for joining.